Hey guys, today's class is a hip extension, PAILs and RAILs class. We're going to be focusing on hip extension. We will need a foam pad to protect your knee for this one and also some balance sticks. So let's get into it. Okay, let's warm up with hip cars. If you don't understand how to do this, please go into previous videos of how to do our hip cars. We can do this in different positions. Today we're going to do this in a standing position. Again, breathe in, irradiate. Really important that we do that. We create full body tension. And then what we want to do is go into hip flexion. Come up as far as we can. Now we abduct. We kind of create the biggest circle possible. And we come into internal rotation. And we extend back as far as we can in extension and back into that neutral position. We don't want to be compensating through our spine. We just want to be working that focus joint, our hip joint. Then we come back, we extend, find our roadblock, then we external rotate. We fight for external rotation, going back down into that neutral position. Let's do this from the side. So breathe in and irradiate. Come into flexion, we go abduction. Now we start to internally rotate, fight for internal rotation, keep fighting for that internal rotation as we extend back, slow and controlled in the pain-free range. Neutral position, now we're coming back into extension, find our roadblock, then we go into external rotation, fight for external rotation, biggest circle possible, and come back down into that neutral position. Okay, let's do 4 reps on each side. So breathe in and irradiate. We're searching for the best possible movement, the movement that we have ownership over, and active motor control over. Slow and controlled, pain-free range. This gives us a baseline of our hip mobility and where we're at and what we need to work on. It also helps, gives the nervous system information, gives nutrients to the joint, helps us maintain our range of motion, and helps us to have that active control in our outer range, opening up more mobility health. And last one. So going into our last one, internally rotate, fight for internal rotation. And then we come up into extension, coming around. Fantastic. Okay, let's do the other side. 4 reps, breathe in and irradiate, coming up into hip flexion, abduction, internal rotate. Good. Extend, externally rotate, coming up. Try not to compensate with other parts of the body. Slow and controlled. Great, amazing. Okay, let's get into our hip extension base. We do need a knee pad, something to protect our knee. I've got some balance sticks here. So what we want to do is gently come into hip flexion. In order to be able to get the line of tension, we want to do posterior pelvic tilt. So anterior pelvic tilt is increasing the lumbar lordosis. Posterior pelvic tilt is decreasing the lumbar lordosis. So get into position go into posterior pelvic tilt, and then gently go into our hip flexion stretch. Once we found it, our line of tension, we start our 2-minute timer. So let me just find my stretch. This one is quite a strong stretch through the anterior part of the hip. So just gently go into it at the start and just build up that intensity over time. But just a gentle stretch at the start. You're going to be in this for quite some time. Let's go through our PAILs and RAILs cues. So my PAILs contraction is going to be pushing down into the floor. I'm going to go into hip flexion. 15 seconds best effort. My RAILs contraction is going to try and make my knee lighter off the floor, and I'm going to be doing like a donkey kick further into extension. 15 seconds best effort contraction. The RAILs contraction sometimes can be a bit crampy. Our nervous system, our muscles haven't had experience in this range of actively controlling this area. And we want to stimulate these areas so that we can get active control and spatial awareness. So that will get better as your mobility gets better. You won't feel so crampy. So, but if you're feeling a cramp, just back out of it just a little bit and just decrease the intensity. So I'm going to count you in about 15 seconds. I can feel a really good stretch here. Okay, PAILs contraction in 5 seconds. 3, 2, 1, pushing the knee down into forward, driving it forward into hip flexion. Really push hard here. Come on, let's go. Push hard. 5, 4, 3, 2, 1. Opposite contraction, trying to make the knee lighter off the floor. We're trying to do a donkey kick. Keep going, keep going. 3, 2, 1, and just gently find the line of tension. And find our new stretch. This is a 45-second stretch. We're going to do another PAILs and RAILs contraction. Okay, counting you in 5 seconds. 3, 2, 1. Push your knee down into the floor, scooping it up into flexion. Keep going, keep going. Keep going. 5, 4, 3, 2, 1. Opposite contractions, trying to go deeper into that stretch. Donkey kick, going into hip extension. 5, 4, 3, 2, 1. Stay in that position. 45 seconds. You'll probably be really feeling it now. I've only got a little bit to go, so keep going. Do your breath work here. You'll be earning your mobility health here. 15 seconds to go. Hold it. 5, 4, 3, 2, 1, and gently come out of this base, and we're going to just do some lift offs. So the way that we do that is just be on all fours. We're going to give your body, your nervous system experience in hip extension of the hip that we've just stretched. And we're going to do 10 reps and just extending as high as you can, squeezing out as much extension as you can. 3, 4, 5, 6. On the last rep, we're going to do 15 seconds. 7, 8, 9, 10, and last one, holding. Keep holding, squeezing the glutes into extension, hips extension. Keep going, keep going. 5, 4, 3, 2, 1, and just slowly come down, and we're done on that side. Well done. Okay, let's now go into our right hip now. Let's set that up. Remember, we need to go into posterior pelvic tilt. So we hip flexion, posterior pelvic tilt, come forward, find our line of tension, and then we'll start our timer, our 2-minute stretch. Gently go into this one at the start, and then build the intensity over time. But you'll find this will be a really difficult stretch to hold. Good, find the line of tension. Breath work here. Okay, 30 seconds to go, and I'll count you in for our PAILs and RAILs contractions. We're going to go into, bring our hip forward. We're going to push and scoop into the ground, into hip flexion. Okay, 5, 4, 3, 2, 1, pushing into the ground, into hip flexion, push, keep going as hard as you can, come on. Best effort here. 3, 2, 1, opposite contraction. We're going deeper into the stretch, into hip extension, like we're donkey kicking. 5, 4, 3, 2, 1, and relax. Let's go into our stretch again. Find our line of tension. 45 seconds here. Okay, 15 seconds to go, and I'll count you in for our PAILs and RAILs contraction. Good. 3, 2, 1, and push down into the ground, into hip flexion. Keep going, push hard here, come on. 5, 4, 3, 2, 1, opposite contraction. Try and make your knee lighter off the ground. We're going to donkey kick, deeper into extension. Keep going, keep going. Whew. 3, 2, 1, and relax into that stretch. Last 45 seconds. So keep that line of tension on. This is a tough stretch, this one. Whew. You're really earning your mobility health with this stretch. Okay, 10 seconds, and then we'll slowly come out and do our lift-offs. 5, 4, 3, 2, 1. Slowly coming out. And let's do our lift-offs. Okay, on all fours, the one that we just stretched, right hip, let's extend it up far as we can, squeeze out as much extension as we can, 10 reps. 3, 4, 5, making sure that we're only moving the hip, not our spine. 6, 7, 8, 9, and 10, and we're going to hold for 15 seconds. Keep going, hold that. Squeeze up into extension, keep holding, keep holding, keep holding. 3, 2, 1, and slowly come out. Amazing, guys. That was a hard stretch. Well done. All right, hip cars. Let's get into on all fours. We breathe in and irradiate. We come into hip flexion. We then go into abduction and internal rotation, searching for the best possible range, searching out for the movement that we have ownership over for just our hip joint. We don't want to be moving other areas of our spine to get this movement. So we don't want to be compensating. We just want to be moving this hip joint. So slow and controlled, searching for that space, creating the biggest circle possible. Good, going to hip flexion. We then internally rotate, abduct, search for that space, fight for internal rotation and extension, then going back into that neutral position. We then extend back, find that roadblock, then we externally rotate. Fight for external rotation. What space do you have ownership over? That's what we're asking. Great, we want to do 4 reps on this side and 4 reps on the other side. Great, last rep, going into flexion, abduction, internal rotate. Fight for internal rotation as you're coming up. Try not to compensate through the back, going to extension, back into our neutral position. Into extension, find our roadblock. Now externally rotate that hip. Fight for external rotation, coming up into flexion and into our neutral position. Okay, so let's do our other side. 4 reps on this side as well. Great. Breathing in and irradiating, coming up into flexion, abduction, internally rotate. Really search for that best possible space without compensating other areas of our body, especially our spine with this one. Great, just really slow and controlled. It's not how fast you do it. We just want to search for that space, get into that outer range. What movement do we have ownership over? Our CARS allows us to know it's the base or the foundational exercise for our hip. This is a representation of what the joint can do and gives us ideas of what we need to be working on, and also our mobility health as well. Great, that's 4. Well done. Okay, capsular CARS, we want to lay on our back for this one. Bringing our leg up into that 90 degrees, our hip, and then we internally rotate and externally rotate. So just slow and controlled. Now we've opened up that space with the PAILs and RAILs contractions and stretch. We now just want to internally and externally rotate. Give our joint capsule and nervous systems that information about that space that we've just opened up. Okay, last rep. Really try and squeeze out as much internal and external rotation as we can. We go to the other side. Again, internally and external rotation. Okay, last rep, squeezing out that internal and external rotation. Great. So we want to see how we pull up after our PAILs and RAILs contractions and when we're in those bases. If you're pulling up a little bit sore, we know we just want to decrease the intensity with the depth of the stretch and the intensity of the contraction. But if you're feeling great, then we know that we can go that extra level of intensity, and we want to go best effort, but safe contraction and safe intensity. So we just want to build this up over time. We want to get re-education, adaptation of those tissues. We want to get active control and better mobility. So let's give it a go.